how is how is interpreting in behavioral health different than interpreting in what would maybe be considered a more normal appointment? So kind of like a specialty or like a primary care visit. It's different in my opinion, and when speaking to other interpreters, because when you're in a behavioral health appointment, more often than not, you're talking about your internal emotional state as a patient. And I think any human can understand and relate to the fact that it's difficult to put words to how you're feeling in your mother tongue. And it's done pretty intentionally. And so as an interpreter, hearing how a patient is describing how they feel internally, understanding what they're saying, and then trying to figure out what the closest equivalent is and repeating it faithfully can be very, very difficult. I remember once I had a patient who was actually a little kid, and he was explaining that something that happened to him made him feel like, in Spanish, he said like he had sand inside of him. And in the moment, I had to determine if I was hearing it correctly, if that even made sense going into English, and then what I would do. And I think I just did it literally, but those are the quick decisions that we need to make. And when you're dealing with emotional terminology and talking about someone's internal state, it can be quite difficult to feel like you're doing it correctly. And then you can also, in mental health, have patients that are having manic episodes, or they're really absorbed in their own story and feelings, rightfully so. And so they're less aware that an interpreter needs to interpret, meaning that they shouldn't stay so much, which then makes it imperative for the interpreter to either have really good memory strategies at hand and a really good memory to be able to repeat everything they said over a long course of time, or the interpreter needs to be prepared to intervene in a way that's respectful, which is difficult because it's hard to intervene and ask for time to interpret when someone's in the middle of relaying how they feel emotionally, because oftentimes it's related to difficult things going on in their life, and it's hard to feel like we're intervening and interrupting the flow, but that's also necessary if we're going to be really accurate. So it's just, it can be more difficult for those reasons.